Okay, this is the Trilogy 202. This ventilator will act as a home ventilator, a non-invasive ventilator in CPAP and BiPAP. It will also act as an invasive ventilator, but I'm just going to show you today how to set it up in non-invasive BiPAP and CPAP. The circuit we use is called a passive circuit. It comes with a pressure line that we don't need with the Trilogy 202, so we need to remove the pressure line before we use it. So that just pulls off there, and you cap it off. So it looks something like that. Take that off and discard it. Now the Trilogy 202 has a high pressure oxygen inlet, so you can deliver between 21 and 100% oxygen, so you need to make sure that's plugged into the wall, into the oxygen port into the wall. So at the patient end you have your exhalation port. Before the patient you always have your filter, so both inhaled and exhaled gas are filtered. So that sits snugly into your mask. This side end fits on the side of the machine snugly, as so. This filter is, you can use it if you want to. This is how the circuits arrive in this is how the filters arrive in the circuit. If you've got a filter this end, it's not necessary to have a filter that end. But if you want to put filters on both ends, it's absolutely fine. So that fits straight on there, or you can fit the tube in straight on there. Depends on how many filters you've got and whether you want to save them. So we'll use it for now. If we go to the machine, we have, see on the front of the machine, we have an alarm button and an alarm silence button. If you press that, it will silence the alarms for 2 minutes. You have your on-off button. These are your navigation keys. This is your no and cancel side. This is your okay and accept side. When you're pressing the buttons at the bottom of the screen, it tells you what to do. So I'm going to just turn it on. So when it immediately starts blowing. So you need to have your mask on your patient before you turn your ventilator on, especially if you're concerned that they have COVID-19. So it turns on to the last settings that it was on. So if you, the last time this machine was on was in passive CPAP with a pressure of 10 centimetres of water. Okay, so if we talk through the front screen, we've got a pressure bar here. This tells us where our pressure is. So our patient at the moment is varying somewhere between 7 and 11 centimetres of water of CPAP. Okay, we've got a respiratory rate, we've got a tidal volume, and we've got a leak. Our leak is okay, and the ventilator will compensate for up to 60 litres of leak. We try to keep it lower than 40 or 50 if we can, purely because you have a lot of unfiltered gas escaping from around the mask, especially for patients with COVID-19. You don't want aerosol generation floating around the room. In normal days, a leak of between 7 and 25 litres per minute is ideal. But the mask has to be comfortable on the patient's face. So a very, very tight mask with no leak probably won't be tolerated. So the least leak for the most comfortable mask is probably the rule of thumb. We have a lot of other information, such as peak inspiratory pressures, I to E ratios, peak flows, minute ventilation, and mean airway pressures. The only thing that we really, because they're so variable in a non-invasive interface, the only thing we're interested in that bar really is our FiO2, so how much oxygen is being delivered. We can deliver between 21 and 100% oxygen. If we needed oxygen in a hurry, we could use our 100% oxygen button. So you can see at the bottom of the screen, if we press that button corresponding, it asks you if you want 100% oxygen, and you can press yes, please, I want 100% oxygen, then you'd automatically receive 100%. You can also cancel it in the same way. Do you want to cancel 100% oxygen? Yes, please. And it will turn your oxygen off. This is your internal battery. Your internal battery lasts for 3 hours. So if you wanted to move a patient on CPAP or BiPAP, then you could do so safely with this ventilator. Then we go into our menu. So if we want to make any changes, the menu is the upward triangle, which is this button here. So we go into our menu. We have a variety of things in here, such as waveform view, safely remove your SD card, and so on. So if we scroll down, we've got event logs and alarm logs. So we can navigate between those with the navigation keys. Everything that you would want to change is in settings and alarms. So if you scroll down to settings and alarms and press select, it will take you into the CPAP settings that our patient is receiving at the moment. We always have our dual prescription off because that's for patients who have home ventilation. If we come down, we come to mode and we can see we're on CPAP at the moment. There's a thing called flex. Flex on the Respironics machines is expiratory pressure relief. So during inspiration, the ventilator blows at the patient to maintain a PEEP in this case of 10 centimetres, or CPAP in this case of 10 centimetres of water. We find that patients find it very uncomfortable to breathe out against a pressure of 10 centimetres of water, and actually you get spikes of pressure within the mask at the start of exhalation. So what the flex does is it decreases your pressure within the mask by 3 centimetres of water at the start of exhalation, which makes it much more comfortable for the patient and improves compliance. So we found in this COVID-19 pandemic that flex has been extremely important, especially for higher CPAP pressures. So the flex can be set at 1, 2 or 3. We've been setting it at 3 and we've had really good compliance with our CPAP. Then you have your CPAP pressures. For our COVID-19 patients, we found that 10 centimetres of water is suitable for most. Different conditions require different levels of CPAP, but again, we can be medically led and that will be medically prescribed. Our LVS tend to be on 8 centimetres of water, and for some conditions, we would have a higher PEEP or a CPAP. If we scroll down, we've got our FiO2, so how much oxygen the patient is receiving. We leave our ramp off, so a ramp essentially you set a time to ramp up to pressure, but in acutely unwell patients, we leave that off. Nebulizer enabled is apparently, according to the reps, it doesn't matter whether it's on or off. So you could put a nebulizer into the circuit and the machine wouldn't mind whether that's on or off. So again, you can leave it off. We have circuit disconnect alarms and apnea alarms, which are extremely important. So we would always set a circuit disconnect alarm and we would always set an apnea alarm. Underneath you have a variety of alarms which we tend not to set because the machine alarms all the time and they're not necessary for the safe use of the machine. So we have high and low tidal volume, high and low minute ventilation. We have high and low respiratory rate. We do set low respiratory rates in CPAP patients because it's a spontaneous mode. There is no backup rate for patients on CPAP. So if they're breathing more slowly, we need to know about it. So I'm just going to scroll to the top and I'm going to show you how to change things. So if we use our navigation keys and scroll down, we can modify whatever we've set. We won't change the mode at the moment because we want to see what CPAP looks like. So if we go down to flex, it says modify, and you can use your navigation keys to edit what you've got. So you can take that to a 2 or a 1. We'll leave it at 3 for comfort, and you press OK. And the same for every single one. So we're going to scroll down to FiO2. We're going to modify it. Our patient has got type 1 respiratory failure, so we need far more than 21% oxygen. So we'd scroll up to whatever we needed to maintain their SATs in target range. Press OK. And you would continue down the list. Ramp and nebulizer stay off. I would set my circuit disconnect alarm. I want to know if the circuit's come off my patient, so I would probably set that at 5 or 10 seconds. Press OK. The same with the apnea alarm. I want to know if my patient's not taken any breaths, especially on CPAP. So again, I would modify it and I would turn on my apnea alarm to probably 10 seconds, depending on your patient's respiratory rate, and press OK. Tidal volume alarm isn't, we don't set, or minute ventilation, although there may be instances where you would like to do that, but I always set a low respiratory rate alarm for my patients who are on CPAP, because usually they're extremely tachypneic. If their respiratory rate's coming down, then it usually means that they're heading into type 2 respiratory failure or heading into trouble. So again, you can be medically led, but 15 breaths a minute is probably a good place to start. Okay, so once I've finished changing all my settings, I literally just press finish and then it takes me back to the settings and alarm screen, and then I press exit. And then I'm away. I'm in passive. So passive is the type of circuit, so that means non-invasive ventilation. I'm in CPAP, and I've got flex. And it tells me the kind of pressures that I'm achieving and what my patient's respiratory rate is. I would probably amend my mask because that leak is a little bit too high, and it tells me how much oxygen the patient's on. If I want to change anything, back into menu, settings and alarms, and go through the system again. Okay. Sometimes the ventilator is left in a locked state. So if we go into our menu, you can see settings and alarms aren't there anymore. It just says my settings. If I go into my settings to change into CPAP or BiPAP or make a change to the settings, it won't allow me to do it. I'm going to come out of there and show you how to unlock the ventilator. So if you press your downward arrow and alarm key until you hear a loud beep, you can see you get your settings and alarms back. So what you need to do is scroll down to the options menu, press select, and change it to full access. Press OK and finish. So now if we go into our menu, we've got our settings and alarms back, and we can change whatever we want to change. So let's have a look at changing this to bi-level non-invasive ventilation into BiPAP. So again, we go into our menu, scroll down to settings and alarms, press select. This time we go to mode and press modify. Now there are lots and lots of different modes on this ventilator. I can tell you that 2 down or 2 up is ST, spontaneous timed, which is BiPAP. Okay, there are all sorts. There's timed, which is full ventilation, pressure control ventilation, AVAPs, pressure control SIMV. There are many different settings, but all we're going to use this ventilator for non-invasively is CPAP or ST. ST is bi-level non-invasive ventilation. We're going to press OK. AVAPs is a weaning mode, which we won't go into now. It's average volume assured pressure support, where you set a volume you want the ventilator to achieve and give it a range of IPAP. And the machine decides how much IPAP to give the patient, so it titrates IPAP up and down. But in acutely unwell patients, we wouldn't use that. What we do need to set is our IPAP, and again, we'll be medically led, and the BTS guidelines are excellent in terms of guiding you what kind of pressures you need. We also have a BiPAP SOP, which is on the intranet, which you can access. We've got EPAP. Breath rate is your backup rate. So your backup rate only kicks in if your patient takes less than 15 breaths a minute. The BTS guidelines say we should set it at 15 breaths a minute. Your inspiratory time is essentially the time that the ventilator inspires for or blows at the patient for on a backup breath. On spontaneous breaths, the patient chooses their own inspiratory time. That should be set between 0.9 and 1.2 seconds for a backup rate or a breath rate of 15 breaths a minute. There's our FiO2, so if you wanted to change your FiO2, you need to be in this menu. We have our trigger type, which always needs to be auto track. That's an adult-based tracking system for the ventilator to pick up when you're cycling in from inhalation into exhalation and exhalation into inhalation, and it makes it seamless and very comfortable for the patient. There is a flow trigger and a sensitive trigger, but they're for paediatric patients, so for adults they need to be in auto track. Our rise time is our rise to pressure. So 1 to 6 is what Respironics use. So 1 is the fastest rise time and 6 is the slowest rise time. So essentially you want your patient to be hitting their pressure as early as possible when they're extremely tachypneic or unwell. So we would set our rise time between 1 and 2 for anyone with a respiratory rate of more than 30. Ramp stays off. Ramp is essentially where you titrate up to the pressure that you require, but we want that off in acutely unwell patients. And nebulizer enabled, that can stay off whether you're given a nebulizer or not. The ventilator copes with extra things coming into the circuit. We have a circuit disconnect alarm, which we always set at 5 or 10 seconds. And we have an apnea alarm, which we always set, which tells us if the patient isn't taking a breath within a set period of time. We have lots of other alarms: high and low tidal volume, high and low minute ventilation, high and low respiratory rate. We tend not to set them because it makes the machine alarm all the time. We know when the patient is apneic because we've already set an apnea alarm, and we know if the circuit's become disconnected. And those are really the only two settings or alarm settings that we need to set for safety purposes. So if we go back up, if we scroll back up, so to change anything, you need to highlight the thing you want to change and press the modify button. So I'm going to turn my IPAP up to 16. I'm going to press OK. Then it scrolls down to EPAP. Do I want to modify it? Yes, please. I'm going to bring my EPAP down to 4. Press OK. Backup rate we usually set at 15. I time somewhere around a second. FiO2, modify, change it to wherever you want it to achieve your target saturations. Auto track, rise time of 2 is fine. Leave our ramp off, circuit disconnect, edit. So you probably want to know within 5 or 10 seconds whether your circuit is disconnected, and we want to turn our apnea alarm on. So again, modify, change our apnea alarm to 10 seconds. So we can see now that we're in passive ST, which is our BiPAP screen. So the pressure bar tells us what pressures we're hitting. So in this case, we're hitting somewhere between 15 and 4 centimetres of water, or just below 4 centimetres of water. We can see our respiratory rate, our tidal volume, and our leak, just like we could with CPAP. And we can see what our FiO2 is. That's the Trilogy 202 in a nutshell.